wrong about that, but I'm not going to regale you with that this morning, okay? But I know when we talk about everything, for many folks, when it's time to transition from their company health insurance plan to Medicare, it is the whole world. It's one of the most difficult, confusing decisions because you're going from a different world of healthcare. The plans are different.
They work very differently, but also really what is so different is that most people spent their entire working life having their employer choose their plan for them or give them a list, if they were lucky, give them a list of a couple of options they could choose from, and that's the plan that they had. Now you have the opportunity to choose whatever you like.
And again, so what we're going to be doing probably for the next 30 days or so,
at least, is
concentrating our efforts and discussions when it comes to healthcare, which of course is sponsored by our very good friends Coventry Healthcare of Missouri
and Aetna Company.
For our Smart Choices About Your Healthcare segment, we're going to concentrate on Medicare because, as you know, even though the new individual policies have to come out, we don't even know anything about them until
probably 24 hours before everyone else knows about them.
Like around November 15th.
November 1st is when open enrollment begins for individual health insurance. And, I mean, we probably can't go this show without discussing what happened yesterday with the Trump administration's executive order, especially because Bill has already called in and wanted to know our thoughts on President Trump's health care executive order.
I love the president. I do.
I
mean, what's so cool is that he is the proverbial bull in the china closet.
China shop.
Right. We know that the healthcare system that we have today. Let's put the people that are Medicare eligible and in Medicare is cool.
Right. They're really off to the side. The Affordable Care Act did not make a lot of physical changes to Medicare. There were some Part D regulation changes, and we can talk about those. But if the Affordable Health Care Act is repealed, individuals on Medicare are not going to see sizable changes to their policies.
No, but we know that the Congress
won't do anything.
Right. I mean, for them, status quo is where it is, and the president said, you know what? No. People are suffering. Rates are rising.
And also
people hate their health care. They hate the plans. They hate being pigeonholed into these
very narrow networks.
4 different color bands: gold, bronze, silver. etc.
Yeah.
The subsidies are confusing. People are playing games with them, just as we do with our millionaire clients.
And
so
the networks are very narrow, so people are having to make difficult decisions because
the whole thing. It's a mess, and so
it's been a mess. Yes.
We actually have a action president who's actually tipping over the cart, and we're going to see some action. So that's cool. In terms of the small group health markets, we do have about 40 to 50 clients here in the city, small companies we work with. We're kind of in a holding pattern, I think. I mean, there's been a discussion about association plans being
formed across state lines, which would be fantastic. It really would be excellent for small groups to have this opportunity because over the last 5 years, we have seen for the majority of our small businesses, rates increase at just as rapid a rate as the individual health insurance plan. So we're looking at 15 to 25% increases year over year just to maintain their same policies, and that can truly be crippling to small businesses as an expense to try and maintain employees because it really has become a standard for most businesses in this country to afford their employees with some sort of health insurance benefit. So in order to keep good employees, you want to have robust benefits. And what the Trump administration has done is basically say that now small groups can band together. So, for example, architectural firms.
We have several of them here.
Exactly. And they can come together, not just and for the sole purpose of health insurance, which has been excluded in other cases, come together to form larger groups, giving them more bargaining power with the insurance companies to reduce their rates. So instead of having your one architectural firm of 100 employees, you can band together with people across the country to form a 100,000 group as opposed to just a 100 people group.
Realistically, I think this is all probably maybe 2 years away, maybe 24 months away. If anything happens where we're going to see the formation of these plans, nothing's going to happen significantly next week. We're going to have court challenges, which, the haters have to do, and that's fine.
And they did mention, potentially getting rid of the subsidy immediately that decision has come, 15 days before open enrollment begins for individual policies. So, like you said, there's still going to be a lot of debating to be had over what's going to happen with the subsidies for 2018.
I mean, at the end of the day, and you can't blame people. It's called "Don't Touch Mine."
Once you give someone a benefit, it's very hard to take it back.
And there'll be solutions that are made. That's what's nice is that business people come to solutions. I mean, that's what this means, is, and I'm looking very forward to seeing what solutions.
Some changes. Well, it's nice to see.
And actually seeing the Congress maybe get together, being forced to get together and basically do something.
Well, regardless of what party you're from, Republicans did win their seats on making changes to the Affordable Care Act. So for all of those individuals who voted for Republicans, I can imagine that they're very disappointed in the fact that they sent their representatives to Congress to make those decisions and they didn't. So now the president has, and we'll just have to roll with those punches.
Yeah, I mean, and as I've said it many times in private before, that